do belly fat, blood sugars, and blood pressure have to do with mental health? I'd like to introduce Professor Richard Holt.
So Shania, thank you very much. So I'm Richard Holt, I'm Professor of Diabetes and Endocrinology at the University of Southampton, where I have a mixed role. So half of my time is spent doing NHS diabetes, particularly looking after young adults with diabetes, but also women going through pregnancy with diabetes and also people with cystic fibrosis diabetes. But within the university, I have a mixed role again, so not only teaching and administration, but I also have quite a big research portfolio, which particularly around the links between mental illness and physical illness.
Thank you so much for being with me today, Richard. I've got lots of questions for you, which I'm going to present to you. Mainly around connections between what we call metabolic syndrome and mental well-being. So let's start off by, what is metabolic syndrome?
Okay, so what's metabolic syndrome? So metabolic syndrome is the constellation of a number of risk factors for both diabetes and cardiovascular disease. So they include having obesity, having high blood pressure, having abnormal cholesterol levels and triglyceride levels, and also elevations in blood pressure. So there's a combination of different things, and in order to make a diagnosis of metabolic syndrome, you need to have 3 out of the 5 that I've mentioned. It's a very common condition. It probably affects about 40% of the population, so it is very common, and as I say, it predicts people who are at increased risk of developing diabetes and heart disease. So if we actually look among people with mental illness, we know that the rates of metabolic syndrome are higher than in the background population, but not only are they higher than the background population, we also see them occurring at a much younger age. So there's a particular study, the Katie study, which was a study looking at a very big study looking at the use of antipsychotics for people with schizophrenia. And what they found, and compared with the general American population, because the study was done in America, that the onset of the metabolic syndrome was about 20 years earlier. So whereas in the background population, it's actually very rare under the age of 40, it was actually much more common in people with severe mental illness, even from the ages of about 20 plus.
Are you seeing a change in trends then in the general population, those who don't necessarily have severe mental illness? Are you finding that the age of onset is becoming younger? Or do you find that the new generation is much more aware with exercise and diet, and therefore the beginnings are a little bit later?
Oh, I wish. No, I mean, what we are seeing is that the rates of obesity are increasing across the population.
Okay.
And when we start to think about what's the link between obesity and the diabetes and the high blood pressure and the abnormal cholesterol levels, well, it's largely being driven by insulin resistance. And what do I mean by insulin resistance? Well, the body makes insulin, and insulin is a very important hormone for controlling normal metabolism. But what happens in situations where there is insulin resistance is that insulin just doesn't work normally. So your body needs to make more of it to get the same action. So if you can imagine that what insulin is doing to the various different cells is to using a key to open up the door to allow the nutrients to go in and have their effect. What's happening in insulin resistance is a bit like that lock is just rusty, so you need more of it in order to turn the lock effectively. And as obesity is going up, we're also seeing increases in insulin resistance, and that's one of the reasons why we're seeing more diabetes, and particularly we're seeing more diabetes in younger people. So when I qualified back in 1989, we very rarely saw children having type 2 diabetes, virtually unheard of, but now we are seeing children with type 2 diabetes.
How does one recognize the signs between the metabolic syndrome and mental well-being? Is it like correlation, causation?
So, I mean, as I mentioned already, one of the very key parts of metabolic syndrome is your weight and the risks of obesity. But if we're being more specific about it, it's weight that's particularly around your abdomen. So being apple-shaped rather than pear-shaped, where the fat is going onto your buttocks and hips. So it's particularly abdominal weight. And that's one of the reasons why when we start to think about monitoring people who are starting antipsychotics, that the recommendation is that they should be monitored for gaining weight in order to prevent that. And of course, that's something that we should be telling people when they start antipsychotics, to watch out for the weight gain, because that will increase downstream and increase likelihood of developing things like high blood pressure and abnormal lipids.
And if individuals are not going on medications for mental health, for example, just in order to maintain their mental well-being, do you think people should regularly monitor their physical parameters, etc.?
Yeah, so within the NHS there is a vascular health check, which means that everybody should be having at least all of the facets of the metabolic syndrome checked at least every 5 years. I think I wouldn't necessarily think that's often enough for some things. Things like measuring your body weight, it's easy to do at home. You don't have to go to see a doctor to weigh yourself. And I think it is important to consider that and to monitor it.
Okay.
I think the other thing to be aware of is, of course, there are no specific symptoms relating to metabolic syndrome, apart from gaining weight. So you don't know that your blood pressure is going up, you don't know your cholesterol levels aren't as healthy as they used to be, you don't know that your glucose levels are going up. So apart from monitoring your weight, you can't monitor the symptoms, but as I say, there is that need to think about having the blood test done, and particularly where you're on medication for psychiatric illnesses. I don't just mean antipsychotics.
No, yes. Some antidepressants cause weight gain as well, yes. And the other thing is, often individuals, and again, it's different for different individuals, often individuals, when they are depressed, they can comfort eat. And on the other hand, individuals who are depressed or anxious may eat less. But when they get better, suddenly their appetite starts to improve. So it works both ways. It's individual,
absolutely.
Isn't it?
Absolutely.
And how then links to if there is family history of metabolic syndrome or heart conditions or cholesterol, and how that links to their well-being, physical and mental well-being.
Yeah, so I think when you think about depression, you're right, that it's weight change rather than weight gain or weight loss, because it can go both ways. And I think everybody's familiar with that concept of comfort eating. And let's face it, when you comfort eat, you don't comfort eat on carrots or salad, do you?
No.
It's crisps and the chocolate, isn't it? Because that's what
everything that's oily and fattening.
Yeah.
Yes. So, and I guess that's when you look out for these things, right? Can people get stuck into a loop of poor mental wellness and worsening metabolic syndrome without even realizing? And does stress have a role to play?
Yes, I think stress does have a role. I think, for the reasons that you described, you get stressed, you can comfort eat. Getting stuck into it, well, I think firstly you've got to be aware that you are at risk, and of course that's something that's important for healthcare professionals to talk about when they see people with mental illness, that they are there not just to improve their mental illness, that they're there to improve their physical state and take a holistic view. So I think it's important that healthcare professionals are aware and communicate that risk. And then beyond that, I think, as we've discussed already, it's the importance of regular monitoring. And, one of the early signs metabolic problems may be persisting is where people gain weight. And I think the other thing is that, when you actually make or find some of these problems, that there are then things you can do in order to treat them. So, there's good treatments for cholesterol, there's good blood pressure treatments, there's good diabetes treatments, and as we've been talking about in some of the previous videos, there are now some good treatments for obesity as well.
For somebody who's newly diagnosed with the metabolic syndrome, where should they start? Should they start with lifestyle, with food, with managing stress? Where does it start?
Yeah, so to be honest, I think people don't get a diagnosis of metabolic syndrome.
No.
Because it's a constellation of risk factors. So I think what people are likely to happen is they're likely to be seen because they've gained weight, they may be seen because they've got diabetes, or they may be seen because they've got cardiovascular risk, and all of those things within that sort of umbrella concept of the metabolic syndrome. But there are good treatments for all of those things. You know, that if somebody develops diabetes, they need to go into the pathway for being managed with diabetes. But also now, if we take one step back, the NHS runs the National Diabetes Prevention Programme. So when you start to see people starting to develop abnormalities in their glucose levels, but they're not enough to suggest to make a diagnosis of diabetes, they still have these options for going through a program to help them make those lifestyle changes in order to reduce the risk. And if that's not enough, there are a number of drugs that can be used as well in order to reduce that risk of diabetes. So I think it's really important that people with severe mental illness, or even more common mental illness, don't feel that they can't access this good physical health care that's available to them because they have a mental illness.
And what about the role of stress? Is it linked to any of these components? Yes, metabolic syndrome is not a diagnosis, but it has like obesity, heart, cholesterol. Is stress linked to any of it? And does managing stress have a role?
So, I mean, you know, you're a much better person to answer than me, really.
Yeah, throw in a googly there.
but you know, when you start to think about managing stress, if you think about anxiety, well, we know anxiety is linked with increased likelihood of developing obesity, increased likelihood of developing diabetes, and also vice versa. If you've got diabetes, you're more likely to develop anxiety. So, and similarly, if you've got obesity, you're more likely to develop anxiety. So there is obviously this cross play between the psychological and the physical body. Well, who would have thought that, hey? You know, it's not. No. It was recognised by Plato over 2,500 years ago that actually we need doctors for the whole person rather than just psychiatric or physical illness. So yes, I mean, managing anxiety can help. You know, maybe. You know, just to take a very simple example, or well, it probably isn't simple, but just to illustrate the point, if somebody says, I can't go out because I'm so anxious, well, they're not going to be able to be physically active if they can't get out of the home. Yes. So if you then treat that anxiety about going out of the home, you can then start to help with the physical illness by helping people to become more active. And we also know that where people become more active, they also, their mental health generally improves
their confidence
as well.
improves.
So you can get into a virtuous cycle.
Absolutely, yes, that's so true, yes. So it's almost like small changes, big impact, isn't it?
Yes, absolutely.
By making these small changes.
And I think it's important to recognise that, you know, you shouldn't treat the mental illness or the physical illness in isolation. You need to try to think about how one will impact on the other. Almost a
multimodal management approach to it, right? Multi-pronged approach, and each is equally important. So finally, what's the one myth you would wish people would let go when it comes to metabolic health and mental well-being?
So what's the one myth? Okay, there are a number of myths. So I think the first myth is that people with mental illness don't get physical illness, and we see far too often that people with mental illness have discrimination. They're often not believed, and therefore they suffer from something known as diagnostic overshadowing, where when they see a healthcare professional, any symptom that they have is put down to their mental illness. Well, in fact, we know that is not true. We know that, in fact, people with mental illness are more likely to develop physical illness than the background population, and it's important to take a proper clinical history in order to determine that. So, and I think that part of that comes from the myth that people with mental illness can't describe physical health symptoms accurately. Well, yes, they can. And I think that if we start to address some of that, we can then start to ensure that people with mental illness have better equity in terms of access to care, and therefore can potentially improve their physical health alongside their mental illness.
That is so good, Richard. Exactly what people need to know, that just because they have a mental health condition, it does not mean they should not seek treatment for physical health conditions early. And also a message for healthcare professionals that there needs to be parity of esteem between mental and physical health.
Absolutely.
I can't thank you enough, Richard, for giving us your time and answering a number of my questions.
Yeah.
The views shared in this video are intended for informational purposes only and reflect current evidence and expert opinion. As every individual's health, metabolism, and circumstances are unique, please consult your doctor or a qualified healthcare professional before making any medical or lifestyle